Hello, everyone, and welcome to today's webinar, Be Part of the Solution, as you help us raise awareness for MPNs. My name is Kapila Vijas. I am the Chief Executive of MPN Research Foundation, and I have had the privilege of sitting in this role for the last 6 years. So this is my sixth Blood Cancer Awareness Month and MPN Awareness Day that I have the privilege of celebrating with this amazing community. We are so grateful that all of you have chosen to spend your time with us this afternoon. We know that there are a lot of other things competing for your attention and your time, and we're always grateful that you choose to spend this time with us. A few housekeeping reminders as we go into today's session. Just so you are all aware, this webinar is being recorded. And it will be available after this event. And so feel free to return to it, share it with anybody in your networks, family, friends, colleagues, and anything you want to revisit in this discussion will be there for you, as well as any resources or links that we discussed today. We will put them in the chat and in a follow-up email, but they'll certainly be here in the recording for you to come back to. A few other housekeeping items before we get into our agenda. You are able to enable closed captions if you would like to have that running. In the back, there is a closed captions button at the bottom of your screen. And to ensure that everyone has the best experience and to limit any background noise or interference, everyone's microphones and cameras will remain off. That said, we still very much want this to be an engaging and participative session. And so we encourage you all to use the chat feature that is located again at the bottom of your screen to introduce yourself, tell us where you're joining us from, and interact with other attendees. And then we'll also be using the Q&A feature for any questions you'd like to ask of our speakers today. And we will do our best, time permitting, to get to all of them. One caveat and reminder with all of those questions is, though we have a lot of resources here, we cannot answer any medical questions, particularly specific to anyone's diagnosis or treatment journey. But if you do have questions of that nature, we suggest you put them into an email into our patient engagement at MPNRF email address, and we will try to identify some sources to get you answers to those questions. But in this session, we will not be able to address any medical questions. And then finally, if you have any technical issues, a couple of quick tips. You might want to consider refreshing your browser or rejoining the session, or feel free to throw a question into the chat and our amazing team will help you out. And so before we begin as well, I want to acknowledge a few folks who've helped make today's session happen. First and foremost, our amazing team at MPN Research Foundation. Today's session wouldn't be possible without leadership from our grassroots and campaign manager, Kylie Roche, who you're going to hear from a little bit later, and her newest partner in crime, Meg Hyam, who is our senior philanthropy manager. Our marketing team, currently led by Jill Hoffman and the rest of the team, and certainly operational leadership from Jennifer Carmen to make all of this come together. So thank you to the amazing foundation team for convening us today. And we know today, our Be Part of the Solution theme is a lead up into September's Blood Cancer Awareness Month and MPN Awareness Day. And that month is very special to us at the foundation because it not only allows us to raise awareness of MPNs, but it also gives us an opportunity to really acknowledge the partnerships that we have in the MPN ecosystem. We know that no single organization can do this alone. No single organization owns MPN Awareness Day. And it's our opportunity to really hold hands with our partners in the MPN ecosystem to raise awareness together, because progress only happens when we work together. We get stronger, we move faster when we work together. And so I want to particularly acknowledge the Canadian MPN Research Foundation, the Canadian Patient Network, MPN Advocacy and Education International, MPN Education Foundation, the Global MPN Advocates Network, and the MPN Cancer Community PD Reporter, as well as the Cancer Research and Treatment Fund. there are so many more partners out in the ecosystem, and these tight-knit group of friends of ours continue to help us carry the message for better outcomes for MPN patients. And then, of course, none of this is possible without the support of our sponsors. We are incredibly fortunate to have a very engaged and committed and quite frankly, mission-driven group of biopharmaceutical companies who work with us. They support our research, they support our patient engagement efforts, and they make webinars like this and sessions like this possible, particularly helping us leverage their channels to continue to raise awareness of MPNs and celebrate MPN Awareness Day. And so today I'd like to especially thank Kartos Therapeutics, Novartis, Sobi, and Sumitomo Oncology for standing with us this year for Blood Cancer Awareness Month and MPN Awareness Day. You can see it truly takes a village. And so whether you're a patient or a caregiver, the researchers and the healthcare providers out there, our advocates, our donors, our industry partners and representatives, really it takes every one of you to raise awareness and really support the mission of curing MPNs. And we appreciate you being part of the solution alongside us. Okay. With that, just a little bit of background and context that I'm sure many of you are aware, but it's always a nice opportunity to go back and reflect on how far we've come and really understand how our mission was born. Because the mission of the MPN Research Foundation, while there are a lot of words and big disease names in here, it's actually quite simple. Our mission is quite simple in that our mission is to stimulate original research in pursuit of new treatments, and particularly cures for the blood cancers known as MPNs. And that's inclusive of essential thrombocythemia, or ET, polycythemia vera, or PV, and myelofibrosis, or MF. And while that feels quite aspirational, in its own words, we want to cure these diseases. We want to advance research, identify unmet needs, and really move the needle on the great work that's being done already to bring cures and better outcomes for patients living with an MPN. And that mission really dates back to our founder, Bob Rosen, who was himself diagnosed with polycythemia vera in the late 90s. And him, along with a handful of patients and families some of whom you'll hear from today, really just were unsatisfied with the answers, feeling powerless and not enough attention being paid to these vague and undescribable family of blood cancers. And so in pulling together the community of patients and other families, this foundation was established. And importantly, this very small group of individuals, patients and their families, banded together to raise a few $100,000. And those very early dollars that were raised supported some of the earliest work into researching the causes of polycythemia vera and led to the discovery of the genetic drivers, the gene mutations that really are today the hallmark of MPNs. And so I highlight that for this community today, especially as we're going into this Disease Awareness Month, because it's people like you, it's this community, it's the power of the community, no matter how small, no matter how few, that really has the ability to impact change. And you fast forward today from that very first research project that was funded, and many of the treatments that are available to patients today, improving lives, improving quality of life, have their origins back to that scrappy early team that pulled all this together. And so there really is tangible, meaningful impact that can come from these community and disease awareness efforts. And if we, think about the origins of Blood Cancer Awareness Month and MPN Awareness Day, when Bob and as we'll hear from Celia Millets, came together and started thinking about what can we do, there was very little known, right? Very, very low awareness of what MPN, or myeloproliferative disorders, as they were called then, and today myeloproliferative neoplasms, were. And so the World Health Organization had come together and finally declared them as cancers or neoplasms. That raised a level of urgency. But importantly, it was in 2013 when MPN Awareness Day itself was established. And it was established as the second Thursday of September. And so this year we'll be celebrating MPN Awareness Day on September 10th. So that's just coming up in a few short weeks. And it's an important day to recognize because, as many of you know, no matter how tirelessly we've worked and no matter how far we've come, there really is still very little awareness of MPNs outside of people who are directly affected by them. We know from studies that were done decades ago that we think there are about 300,000 patients in the US that have been diagnosed with one of an MPN. But because they are so rare and so heterogeneous, meaning, every patient's experience is different, the way in which they present symptoms or get diagnosed, it can take a long time to really recognize that there is an MPN. And so we believe at MPN Research Foundation that in fact that 300,000 number of patients in the US is probably quite low, and more studies need to be done to really understand how many patients are affected by an MPN. And that just requires more awareness because with awareness, it allows more patients to find community, to find support, to find resources. It allows more physicians and people treating and seeing MPN patients to understand and recognize symptoms and get more focused on the diagnosis and treatment plans. Awareness allows more participation in clinical trials, and it really helps spread just resources and a better understanding of the disease overall. And so we're really grateful to the community that continues to help us spread the message, spread the word, create awareness, and let people out there know who may be feeling alone and isolated that there is a community here for you with plenty of resources who are working tirelessly towards better outcomes and cures for this family of MPNs. And with that background, it is my absolute privilege to introduce our featured speakers today. And I want to welcome, before a brief introduction, I want to welcome first and foremost Celia Millets and Stephanie Sindrick. Celia has been part of our MPN Research Foundation family for quite some time, since the beginning, as a former board member, as a honorary board member. And fast forward today, Stephanie Sindrick, her daughter, serves as a board member at MPN Research Foundation as well. And it was, their family, their dynamic of these two powerful and really ambitious ladies that has driven a lot of the work that they've helped fund here at MPN Research Foundation. And so, shortly after Stephanie was diagnosed with essential thrombocythemia at the very young age, as a teenager at 16, Celia got to work and started organizing her friends, her family, and her community around a golf tournament with a very simple but ambitious goal, is to just bring people together, create that awareness, start a conversation, and raised a meaningful sum of money for research that has had a profound impact. The founding of Friends of ET Research was very catalytic in the community, in collaboration with us at MPN Research Foundation. And that also led to Celia being honored in 2018 as an MPN hero, which we were very proud to celebrate in recognizing those efforts, because again, together this mother-daughter duo has really had a profound impact on the MPN research community and advancing a lot of the insights, the work, the disease knowledge that we have today. And so with that introduction, I would love to turn it over to this mother-daughter dynamic duo, and start with Stephanie and coming back to the beginning of your journey, asking you, what was it like when you were first diagnosed with essential thrombocythemia as a teenager?
Sure. Hi, Kapila. Thank you. It's hard to believe that that was almost 30 years ago when I was diagnosed with ET. I was 16, almost 17. And certainly it was very overwhelming. It was very lonely in the very beginning. This was back in the dark ages of the late 90s. So, like, the internet was just being created. So it was hard to find really valid, up-to-date information about about MPNs. For me personally, had been very symptomatic of the disease itself. And so that was creating many challenges for me just in my day-to-day experience, being in high school and being in school plays and trying to be a normal kid. Uh, Luckily, there were treatments available to help me with that, but there was also the challenge of balancing the side effects that came along with those treatments. Learning how to give myself an injection, within when I was started on interferon, uh, the challenges of the fatigue, and I lost a lot of hair with that version of interferon. Um, so it's quite an emotional journey, and it still can be, honestly. um, the forever part of ET is was certainly shocking when I was diagnosed. And when I still look down the road, I say, "Wow, okay, I still gotta keep learning how to walk with this disease." But in terms of navigating life, I choose to land on a perspective of um, focusing on, like, the growth that has come from these challenges, and learning how brave I can be, and learning how to show up for myself in a variety of ways. Um, I have, in a lot of ways, I've learned how to live because of my MPN diagnosis.
Wow. That's an incredibly remarkable perspective to have, going through this from such a young age, and taking a very growth-oriented perspective. Celia, as a mom, that's also got to be tough on you. So
Mm.
what was it like going through this journey with Stephanie, and what was going through your mind in the early days, and now, even as you look back on it, how does that affect you as a mom?
Oh, wow. It was a very difficult time for our family. I was in shock. I was in disbelief. How did this happen to my daughter? Um, Back then, the ET was known as an old person's disease. It was almost unheard of in children, which made it even more confusing to understand how she acquired it.
Mm.
And she the internet was young, as Stephanie mentioned. So there was a lot of bad information that was ended up being erroneous information, but there it was. You read it anyway. I did find some chat rooms where I was able to link up with other patients and sometimes other caregivers who helped, hold my hand through the process. She was underage, so I had to be her best advocate. She couldn't really advocate for herself at that time. She was not 18 yet, but so I had to educate myself and become her best advocate. And she, was sad that research was not very active for her disease. She was sad that there was no known cure. And ultimately, that was kind of what inspired me to create my nonprofit, um, and giving her hope. That was, hope for her future. We just didn't know what was in her future at that point. Um, we just didn't know, and now here we are, almost 30 years later, and she's in good shape right now, and we're very happy to report that on her behalf.
Yeah, that's got to be an incredibly tough journey.
Yes.
Um, but it does sound like your family became stronger together by feeling empowered to take action. Um, And so in the early days, you also had a close connection to our foundation, and had the opportunity to connect with Bob Rosen. What was it like at that moment in that period of time connecting with the foundation, and what has stayed with you through that connection over the years?
Well, that was pretty interesting. I had done a lot of research and I didn't know of anyone else that was going to be raising money for these diseases. And Bob and I learned about each other in the chat rooms that we had both discovered on the internet. And he was curious about me and I was curious about him. So he decided to fly from Chicago to New York City, where we were close to New York, about 60 miles away. And we met him in New York at a coffee shop on some avenue. And Stephanie came with me and we talked. We ended up spending a lot of time together. And, Bob's vision for his foundation was very bold, excuse me, very bold and all encompassing. And all I wanted to do was give Stephanie hope and raise as much money as I could, of course. But he was humble and he offered me the opportunity to take on his vision with my own organization. And he would jump on board with my organization if I chose to do so. But I told Bob, I said, that's not my focus. My focus is Stephanie. And that's about all I can muster at this point. So I said, you take it, you lead the charge. And he very eagerly jumped in with both feet. And we began collaborating from the very beginning. And after the year 2000, when I had my first golf tournament, we both had about the same amount of money, and we were able to fund Dr. Joseph Percol. He was the first researcher that we thought had valid scientific research ideas. And ultimately, his research in those early years did lead down the road to the JAK2 and ultimately the CAL-R mutations. So we began moving the needle for the science at a pretty rapid pace. And that was very exciting. Of course, we're still waiting for the cure, but that's hopefully down the road. And Bob's vision is still being realized today, especially with you, Kapila, and under your leadership and the staff and the board of directors and the scientific advisory board. You guys are still leading the charge just as eagerly as Bob did.
Well, Celia, I think we're taking our cue from you to be part of the solution, right? That what the action you took in those early days really defines how you can be part of the solution. And so we are just privileged to continue in that with that role model to continue to raise awareness, which I have to say, and you all know this well, our community knows this well, raising awareness is tough. It's an uphill battle for us because these diseases are rare. They're not always recognized as cancers, even though they very much are. They're a little bit harder to detect and diagnose, and really, bring awareness to. Why for you, Celia, and then maybe turn to you, Stephanie, after that. Why do you think awareness is still so hard? And why is it still important for us to try to do today? Celia?
Well, without public awareness, people just don't understand what the disease is. And I would say, well, my daughter has been diagnosed with essential thrombocythemia, and they just kind of go, huh? What in the world is that? Or their eyes glaze over. They just can't comprehend what that might possibly be. So when the World Health Organization did reclassify it as a cancer, we could call it what it was, as opposed to just a disorder. A disorder just seems like something is off kilter. Well, it's more than a disorder. And of course, we know now that these diseases can also progress. So you start with the public awareness. You let people know what the disease is. They're still orphan diseases, meaning the scientific community really won't pay much attention to them on their own. We need to fund that research. So you start with raising the public awareness, and then you try to be part of the solution by asking for funds.
And I mean, that's where it starts, right? And
Yeah.
Stephanie, for you, kind of watching your mom evolve this over the last 30 years, what has awareness meant to you?
Yeah, I can, piggyback onto most of what she has said. I think awareness is the seed we plant that can grow the tree to get us to our goals. You know, the we all are looking for the same thing. We want better understanding of the diseases. We want better treatments, and certainly the cure is the ultimate goal. And so I think, spreading the word in any way that we can, creating that awareness, and getting our communities involved is really how we can accomplish those goals.
Yeah, that's great, and that's one of the reasons why, we want to tell these stories so others can feel empowered and inspired to get their communities involved. And Stephanie, you've been incredibly gracious with us at the foundation here today in sharing your story in a, sometimes vulnerable way, but being quite open about what your journey was like. And that's not always easy to do, no matter at what stage in life that you're diagnosed with the blood cancer. And so maybe one question for you to try to help others think through this is, what helped you find that voice and that confidence to be able to speak about something so vulnerable and something so personal?
It's a great question. um, I think the confidence to speak it is still certainly a work in progress for me. I mean, uh, it's talking about one of the most personal things in your life, really. And so for me, raising awareness, I'm talking about something that's created the biggest obstacles in my life. Um, but then I also will, see that through line. And so the the concern of kind of what people are going to think or how people will respond, or that hesitation of the what ifs, um, it's certainly a normal response. I just felt it. I just had a birthday. I'm in the middle of a birthday fundraiser now for MPNs. Before I click it, I'm like, oh, there's contacts I've made on social media that don't know this about me yet. Like, they're going to be learning this about me. And then I'm like, why shouldn't they learn this about me? It's a story to tell. And that awareness, putting that story out there is how I can accomplish one of my goals. It's pushing back on ET. It's giving the control back to me on how the story gets told. Um, so the vulnerability part is it's there, but ultimately I'd say just go for it, like do it. I really, and as a whole, I've not been let down. I think people can pleasantly surprise us the way they can show up for us. MPNs are rare things, but there's people dealing with chronic medical issues, and so they may not know exactly what it means to live with this, but they've dealt with maybe something similar, and so that can kind of pull on their heartstrings and get them involved. I think sharing your MPN experience is how that community gets created for you. um, I think that MPNs become a little less rare every time I share my story. And those conversations, it's how we accomplish our goal. It's a really important leap of faith, right? To just share our story.
I think, Stephanie, you just hit the quote of this whole session, is that NPNs become a little less rare every time you share your story. And I think that's a really important message for all of the patients and caregivers out there to hear, and also to hear that, that confidence and vulnerability, like you're still building it every day, right? It's not, they're not alone out there and thinking that and feeling that. And so, I think those are very important messages to hear, for this audience. So thank you for sharing that.
Of
Um,
course.
you also just mentioned, Stephanie, that you're embarking on a fundraiser. And
Yes.
ultimately, we're here to raise awareness and hopefully inspire some fundraising. Together, you and your mom have raised just under $900,000 over the years towards for Friends of ET research.
Yeah.
You're coming up, both of you, on potentially $1 million milestone here with the fundraising that you've been
Jeez.
doing. What would that milestone mean to you, if you're able to achieve that $1 million milestone?
Mom, you want to lead that? You want me to go for it?
Well, sure, I can take that. Well, first of all, I feel incredibly humbled at the amount of money we've been able to raise. It kind of surprised me, only because I had no experience doing fundraising, but I was really surprised at how our local community rallied around and united together around Stephanie and supported her and lifted her up, um, opening up their pockets to fund research on her behalf. And um, you have to remember, my goal, I didn't have any goals in mind other than just to offer her hope, just by, being part of the solution, taking that first step. And our events became, over the 7 years that we had the golf tournament, became like an annual reunion. The same people kept coming back every year. And Stephanie would speak and tell her story, and it would be very emotional for her and emotional for our participants. And they just rallied around her in ways that I didn't anticipate. So yes, it's very humbling. If I do get to 1 million, I don't need to get there, but hopefully I will. But I've already accomplished, I think, the goal I set forth for myself, which was to give her hope.
That's,
Yeah.
that is such a powerful way to think about it because, even you started small, you started without a goal in mind. And I think that's the key takeaway message here is that every little bit counts, every step incrementally builds. And over time, it really has a profound impact because it just sort of builds cumulatively over time. And so I think, a message to many people out there thinking about starting fundraisers or finding ways that they can be part of the solution, even if you start small. So Celia, what advice might you have for folks out there thinking about starting fundraisers or have never done it before? Do you have some advice or some first steps they can take?
Well, my advice, here's how I started. I just started talking to some of my close friends. I told them, that these were orphan diseases and the scientific community didn't pay them much attention and there's no cure. Treatments were very limited. Would they be interested in helping me raise money? And everybody that I spoke to said yes. So within a week or so, I had formed my board of directors, if you will, and founded the nonprofit Friends of ET Research. And we just moved forward. So what I would say is start, just do it. Start talking about what you want to do, and together you and your friends can brainstorm what makes sense for you and your community to raise public awareness and to become part of the solution by hopefully raising funds in your community. um, I'm not going to say it's not work, but if you have a team with you, like a board of directors or just a group of friends, it doesn't have to be well organized, then you're not alone. And with your friends, you not only get their expertise and knowledge base, but you also have access to their friends and their business colleagues. So your outreach kind of expands the more people you get involved. And I think that's another reason why I was so successful in the very beginning, was the people that I pulled together to be part of my team. So I would say be part of the solution and just start talking about it.
Yeah. That's really one great advice, and really appreciative that you both have shared your story, your family story that is very personal, but also very profound, and empowering. And so thank you both for sharing that and joining us today, and being with the MPN community. And hopefully a few people out there have gained some inspiration from you for this. Before we turn it over, though, to the next segment, I want to see if we can ask Stephanie and Celia a couple of questions here. And so first, Stephanie, to you, it is unique that you were diagnosed at such a young age, and that does have a profound effect on, how you socialize with your friends, maybe, how you think about the activities that you go into in school, whether you think about being, more active on the sports side or the musical side, whatever the activities were that you were
Yeah.
interested in. How did you sort of navigate that at such a young age?
That was a really huge hurdle for me to deal with. I think my baseline personality is I just want to go, 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 go. And ET was like, sit down and like lay down for a long time. And so finding that balance, it was really challenging. And sometimes I still have days where I have to say, okay, like set this time for yourself and give your body rest. So even now it still will kind of create some restrictions for me. Yeah, I would have to, like, in high school and college, I had to limit like my social activities outside of school and what I was responsible for. Um, I, as you know, I had a lot of support with my family, which was a huge part of my success on how I learned how to live with this. I also had, by the time I was in college, I had an MPN expert in New York who really taught me about the importance of quality of life. So when I was doing a project in school, or when I had a big, let's just say a long weekend away with friends, if I had things that I was trying to live, right, and have fun and be young, I had a team, including my doctor, that she would work with me with changing my dosing around. She was always talking to me about quality of life and focusing on that for myself. She was a really huge advocate for that for everybody. But I think given my age, that was like part of how she cared for me and guided me.
That's fantastic. That's phenomenal. And it is true to remember that we have an amazing community of care providers and healthcare providers in the MPN community that do keep quality of life front and center, and give
Yeah,
you kind of guidance and advice. Maybe one last question related to that, but
sure.
Celia,
Yeah.
from your angle of this. So Stephanie, you have now a very accomplished career in healthcare. You also
Yeah.
have a family of your own that you are, I'm sure, chasing after. And
Always.
I know, yes, always. And as we hit these milestones, our parents sometimes help guide us to think through career choices and family choices, and how those milestones evolve. And so Celia, again, coming back to maybe as a mom, how did you think about helping Stephanie through making those life choices, or supporting her through those life choices, and um, you know, building a very strong and successful career, and an active family?
Mhm.
Well, Stephanie's pretty independent. um, she, she kind of forged her own way. I offered her the support that she needed to kind of start, living life and enjoying life, on her own. And we tried to always support her. She lived in New York City for a while. She was very busy and active, still going to school. And then after graduation, she was working hard, and she would still come home to Connecticut, just to get out of that rat race that the city can be. And, we always provided her with that shelter that she could always come home to the quiet Connecticut, unwind and, rest up, and then get energy to go back into the city and do her job and earn money and, do what she was doing at the time. So we've just always tried to provide like a safe haven for her, at any time. And I helped take care of her babies when they were born.
Yeah.
When her ET came back, it came back pretty rough. It was a little rougher to deal with than the first time she had it. And there were days when I had to take care of her as well as her babies. So, we've just always been there to support her in any way we could, and very happily did that.
Yeah.
That's wonderful. Thank you for adding that extra commentary from the questions from our participants today. So thank you for that. And thank you to the audience for sharing your questions. If we didn't address your questions, we will in a follow-up. And be sure to make sure you have be sure that you have the answers that you're looking for. So again, Celia and Stephanie, thank you for sharing today. With that, I'm going to turn it over to Kylie Roche, our grassroots and campaign manager, to talk more about our fundraising opportunities.
Thank you so much, Kapila. Thank you, Celia. Thank you, Stephanie, for joining, sharing your stories. I'm really glad I was off camera for that, because there were several moments where I was starting to get a little teary-eyed, and I just really appreciate you sharing your story with our community. I know it means a lot to me, and it means a lot to everyone here. So thank you. For those of you who haven't met me yet, which I'm sure is most of you on this call, my name is Kylie Roach. I joined the foundation about 2 years ago. Prior to joining the foundation, I was working on national grassroots campaigns that focused on everyday impact, but primarily around care issues like supporting family caregivers, expanding access to home and community-based care, and lowering the cost of prescription drug prices, which was all really important work and has led me here today. And the most important thing I've learned from that is the importance of using your voice and sharing your story to create change. It is truly the most effective tool that we have, and it's my favorite part about being here in this MPN community. We have some of the greatest group of advocates I've come across in my 7 or so years of doing this work. So I'm here today to show off some new tools, but also introduce myself and let you know that I'm a resource, and you can always reach out to me if you have questions, if you need ideas, feedback, or troubleshooting your page. MPN Awareness Day is coming up. We just want to let you know that it's easy now to fundraise on our website with some new tools, and I'm just here to demo them and show you how they work. If you go to mpnresearchfoundation.org, give it just one moment for this to load. You're going to navigate over to the Fund Research tab and click Create Your Own Fundraiser. From here, you're going to enter what we are calling the DIY Fundraising Hub. It's a one-stop shop. It has everything that you need to share your story, raise awareness, and raise funds. You can explore some examples of real people who have created fundraisers for the foundation, like Martha, who is one of my favorite people ever. She dedicated her successful stem cell transplant to raising money for MPN research and raised about $5,000 doing so. You can also access a DIY fundraising toolkit here for ideas for different fundraisers, tips for sharing your story, tips for making the ask, because asking for money is not easy, and some important talking points about the foundation and our pursuit of a cure and how much money and work it really takes to fund that research. All of that is available in this toolkit. We've also got a frequently asked questions guide and some guides for in-person events. If you want to do what Celia and Stephanie did and host an in-person golf tournament, that's awesome. You can use one of these personal fundraising pages to support that work. Just let us know if you do, but otherwise, creating a fundraiser online is one of the easiest things you can do. We're going to click Start Fundraising to get started. You'll be prompted to choose whether you're fundraising as an individual or as a team. I'm going to choose to sign up as an individual for this example. You'll be asked to set a goal. The goal can be anything you want. $500 will populate here automatically, and maybe that's an achievable goal if this is your first time ever doing something like this. But if you're really experienced, consider setting a larger one and consider celebrating milestones along the way. No amount of money is too big or too small. Any dollar amount helps and gets us closer to our goal of eventually curing myeloproliferative neoplasms. Then you're going to register your account. I already have an account, so for this example, I'm going to give you guys a fake one. I'm going to be Mrs. Marrow today. And I'm going to go ahead and enter my fake email, fake address, and I live in Denver, so Mrs. Marrow is going to live in Denver too. We'll click next. And the last thing you do before completing your registration is you're prompted to make an optional gift. Again, this is optional, but it shows other people that you're invested. So if you do this, it'll show up on your fundraising page and let everybody know that you're in this fight too, and you're asking for their support in addition to that. Once you click complete registration, an email will go to that email account that you registered. You'll be asked to verify your account, create a password, and then you'll be able to sign back in. So to show you how that works, I'm just going to go back to our hub. I'm already signed in up here at the top, but our sign in button is going to be right up here. And then you're going to be able to manage your page inside of your fundraising dashboard. This is a quick spot to grab any link, edit your page, look at the donations that you've raised, send emails, and fire off social posts. All of that can happen in here. Once you have registered and signed up, the tool will prompt you to follow each step one by one to make sure your page is all set. I encourage you to add a photo of yourself. Everybody likes to know who they're supporting. And then you're also going to want to edit your page with your story. So up here in My Fundraising Tools, you'll click Edit My Page. And here you can autonomously add information. I kept this super short for today's example, but your story can be as long as it needs to be. It might be 30 years worth of story that you want to tell. This has no character limit, so please go ahead and add as much detail as you like. Just know that less is more often when people are online and their attention spans are really short. But all you have to do to edit it is click this little gear icon here, and it will open up the editing box. You can add all of your text here. Make sure you click update and make sure you save your page when you're satisfied with it. Once your page is created, you can go back up to My Fundraising Tools and share it with the world. Here is where you'll be able to send automatic emails, Facebook posts, and tweets on X. I'm just going to demo the email part really quick because we know that emails are the most effective way to reach people. You can either email your donors to thank them, or you can send them a fundraising email. Since we're going through this like we're just starting it, we're going to send a fake fundraising email. You're going to want to title it just something for you, just so that you know what it is. I'm just going to call it fundraising email number 1, but there's no naming conventions here. You'll choose a template and click Ask Others to Donate, and it's going to populate a message that you can fire off and send as is, or you can customize further to make it more personal to you. This is something simple and boilerplate. I'm raising money for MPN Research Foundation to one day fund a cure that will, for rare blood cancers collectively called myeloproliferative neoplasms. I thought of you. Would you be able to donate and help me? Then you'll be able to add your email addresses down here or import them from a spreadsheet, enter them one by one, however you like to do it. And the other cool thing about this tool is you can schedule emails in advance. So it's not just one-off. You don't have to come in here over and over again. You could schedule emails periodically. You can send one to send on MPN Awareness Day or on your birthday or any day of the week. You could send an email when you've reached 50% or 100% of your goal. All of that is capable inside of here. There's a few other things about the tool I want to show you guys how to use, so I'm going to jump around just a little bit. Once you guys are ready to get started, there's this library of resources in here with a bunch of information available on mpnrf.org, but all here in one place so you can download it quickly and easily. If you don't understand, for example, myelofibrosis, or your family doesn't understand myelofibrosis, you could download a one-pager to send them to educate them a little bit about the disease and help you raise awareness by spreading accurate information about MPNs. If you know you're affected by an MPN but don't know anything about the foundation, you can grab a one-sheeter about the foundation and our work and our impact on research. If you know all of that and you've got all of those talking points down and you just need help with the hard part of sharing your story and asking people for money, which is very difficult work, you can grab some quick guides here that are also featured in our fundraising toolkit, but you can grab them one at a time here if you'd like. And lastly, I want to show you guys, oh, actually two more things. The donation manager here is where you'll see all of your gifts. Any gift that's made online is going to show up here automatically. But if someone hands you a paper check, just so you know, you got to upload that manually. So maybe encourage people to give online so you don't have extra work to do. But checks are always welcome. You can track your progress here and you can also update your goal. So let's say you started at $500 and you smashed it with 3 people, go ahead and increase that goal to 1,000 or 2,000 based on what you think is achievable. Or if you've started with 10K and you feel like you need to roll it back, you can update that here. You can also manage your registration preferences, update your personal information, your permissions. If you don't want emails being sent to you, please go ahead and uncheck that box. We want to make sure that everyone's opted in to the communications that they want to receive. And then the last cool thing I'll show you is you can earn badges when you make progress. So if you're the top fundraiser or have the most gifts, those badges will show up in here. You can lose them though, so if you're competitive like me, good luck. But that's the hub, you guys. That's the whole thing. If you want to just visit your page, show you what my page looks like on its own, there's a link down there, and you can click that. But I can't stress enough how easy it is, and the fact that we do have tools online for you to answer all of your anticipated questions. But if you don't find the answer you're looking for, that's what I'm here. Please feel free to email me directly or email our giving inbox, and I will help you out. Just to recap, these slides will go out after. Your steps are start the fundraiser, create your account, personalize your page, share it, and track your progress. That's it. And if you need a quick access to links, those are right here for you. And that's all. So I'm going to kick it back to Kapila to take us home. But while I still have the camera on me, thank you all for the time. Thank you all for staying on the phone. And we hope you'll help make this a great Blood Cancer Awareness
One quick
Month.
question, Kylie, I think that just came through that maybe you can address. Is there a texting feature in this platform where you could
There
contact
is not yet. There is not yet. But what you can do, I'll demonstrate. That's a great question. Inside, sorry, I got the Zoom thing up here. Inside your hub, if you want to send a text, just grab your link and copy it and send it to yourself, and you can send that link out. So I would click this little copy button right here and send that out via text, but we don't have a way to automatically send a text here right now. I'm sure that's an update that Bloomerang will make in the future.
Great. Thank you for that, Kylie. And thank you for making this tool available to the community. You know, I think one of the things that we want to continue to do for the community is provide these tools and resources that really do empower you, put the tools in your hands so you can really be part of the solution. And as you know, we've heard from Celia and Stephanie today, right? Every little bit counts. You've got to start somewhere, but every little part does make a difference. So Kylie, thank you for making the platform available. And now the community knows where also to find to get their questions answered and hopefully elevate our fundraising opportunity to continue to fund research. So thank you for that.
Thank you so much.
And then before we close, I just, as much as we value your contributions and your willingness and enthusiasm and passion for putting fundraisers together, we also want to remind you and we acknowledge that there are so many ways that you can be part of the solution. It doesn't always have to come in the form of a check or a fundraiser. So if you think about, if you are someone who's living with an MPN diagnosis as a patient or a family member or a caregiver, just participating in the education and informing yourself and sharing our UNMPN resources with friends and family and maybe other patients who who are not as active and engaged, just sharing those resources is a way to be part of the solution. We have an amazing MPN Pathways research advocate training program that our led by Sarah Douglas, our patient engagement lead, has put together over the last couple of years, where you can learn more about research and clinical trials, and really arm yourself with the language and the education to participate in research a lot more actively and proactively. And just being empowered to do that can really make a difference. Many of you have heard of our MPN Progression Registry. This is our major initiative to try to advance the research by collecting surveys from patients, as well as some clinical and medical information to continue to study the disease, how the disease progresses with real live patient data. And so when you are ready, when you are comfortable, participating in that can really help us leapfrog what we know today about MPNs and accelerate our ability to do the research. So again, many ways as a patient to participate and be part of the solution. If you're one of our advocate partners or other patient support groups, continuing to share those resources and connecting patients either back to us or to those clinical trials. And our researchers and clinicians, right? Just making sure that perhaps your patients or your community has access to these resources, helping us inform our research, helping us advance our knowledge base, and supporting the collaborative research that we all do together. And I want to make sure that we give everyone a bit of a sneak peek into what's coming on MPN Awareness Day on September 10th, which is the announcement of our 2026 MPN Challenge Awards that we are very excited to announce to the community. And the funding of those would not have been possible without all of your efforts to help us fundraise. And so excited to share those with the world on September 10th. And then finally, to our biopharma and industry partners, those who made today possible and this campaign possible, which were Kartos Therapeutics, Novartis, Sumitomo Oncology, and Sobi, help us raise awareness and conduct disease awareness campaigns for this month. But also continuing to be patient-centered in that programming and continuing to engage with the community and recognize that the patient voice, the caregiver voice is an important part of bringing therapeutics through the clinic and to patients. And so we want to thank all of you, all of our stakeholders, for everything that you do every day for us. Everyone can be part of the solution in so many different ways. So thank you. Thank you for being with us today. Thank you for starting to think about how you want to activate for September and Blood Cancer Awareness Month, and stay tuned for some exciting announcements on MPN Awareness Day. Thank you.